Hello, my name is Dr. Aaron LeBauer with LeBauer Physical Therapy here in Greensboro, North Carolina.
And I'm Dr. Nielsen with Kaizen Physical Therapy.
And today we're here to show you and tell you about how to fix your herniated disc once and for all.
This is something that we see quite often in the clinic. Patients will come to us and say, I've been diagnosed with a herniated disc. The next step is, I'm told that I need surgery, but I don't want surgery. What should I do?
Right. Or even people who have been told they had a herniated disc 10, 15, 20 years ago, if not just even 9 months ago, and they still are like walking around like, I've got the herniated disc. The herniated disc is now the thing that's keeping me from doing all the things that I'd rather be doing. And we help people like that get back to doing the activities that they love to do and stay fit and healthy. And so the number one thing we want you to know is that herniated discs are absolutely normal for people without pain. Herniated discs are not always the cause of the problem, but it's really easy when you get an MRI or an X-ray to say, aha, there it is, I found that thing. That's the cause of all the pain. So Dr. Nielsen, what might be contributing to the pain and discomfort people are experiencing?
Yeah, a lot of times it's muscles are a little bit angry. So a lot of times a herniated disc diagnosis is actually an angry muscle in the hip, angry muscle in the back, and it's starting to, the typical presentation first of a herniated disc is some sciatica down the leg. And that could be caused from numerous things. Now when you have sciatica and they go in and look at an image, again, with an X-ray and MRI, you can't see pain. All they can do is see what's on the X-ray and MRI, and they assume that what they see is the cause of pain. And there's been multiple studies time and time again where they see people who have no symptoms, so absolutely no pain, no tingling, no sciatica, but yet they have herniated discs. So usually a herniated disc is not the cause of pain.
And it's nothing to worry about. We're probably standing here, if we did MRIs of ourselves, we probably each have a herniated disc. Herniated discs heal. If they actually do herniate, they will heal over the course of 5 or 6 months. And it's nothing to worry about or be alarmed about. And that's to say that knowing about it, having seen an MRI or X-ray, being told that this is the cause of your problem and you're not in control of it, your body is doing something out of your control, and being worried or concerned about it, increase the amount of pain and discomfort that you do have. So one of the best things to do is to make sure you continue moving and walk on a regular basis, move your back because it's been designed to move. But the problems are a lot of times not just in your back, they're typically other places like your hips or legs, knees, somewhere else. And so that's where we come in, is because we don't just look at your back and try to fix your herniated disc. We're looking at what's the real true cause of the problem and addressing all the other causes or contributors to why you're hurting right now.
Yeah, so I think somebody's going to question and say, if you're watching this, you're wondering, well, how do I really tell if the herniated disc is the problem? Well, it's not through an X-ray or an MRI. The way that you really tell is by getting somebody to look at your movement and seeing exactly what's going on, and then correcting that. And then if it's still the symptoms remain, then we're thinking, okay, maybe it is the herniated disc. But that doesn't necessarily mean you need surgery. Like Dr. LeBauer said, herniated discs do heal on their own. So there is that option to wait and see, but there's also, we want you to realize that even though there's a herniated disc, it doesn't usually mean it's the cause of symptoms. So if you've been diagnosed with a herniated disc and you're wanting to get looked at, go ahead and click the button below. You can either jump on the phone with myself or Dr. LeBauer. Talk to us about what your symptoms are like, what increased symptoms, what helps with it, and we'll get to know a little bit more about your story. And then we can help and guide you in the next direction that we believe you should take to getting this resolved.
Right? Because once we see you move, hear what's going on, know what you would rather have happen again, we can give you a very clear path towards being active and healthy again. We've both worked with people who've had herniated discs for years or been told never to pick something up and had them moving again relatively quickly. It's not a quick fix, but it's a process that we can take you on a journey to get back to your life and continue healing and recovering from what's going on. So click the link below, and we look forward to speaking with you soon.